Life again. So today I'll be talking about 7 myths. I'll be debunking 7 myths that revolve around the questions I've been getting on contraceptive pill. So get your pen, get your paper, share this link to anyone that you feel will need this information I'm about to share. If this is the first time of coming across contraception, it simply means prevention of fertilization, prevention of conceiving a baby, prevention of, if you hear use of contraceptive pills, is the use of pills, use of drugs, hormonal drugs to prevent pregnancy from happening. So there are so many methods of contraception, and the use of pills is just one out of many of those methods. Yeah, one out of many of those methods. And there are, for example, we have the use of condom. Yes, you are surprised, condom is also a method of contraception. Yeah, we also have the use of lactational amenorrhea method, a situation whereby the woman is breastfeeding her baby, and the woman is breastfeeding her baby, she won't be ovulating, ovulation will not occur. That way, fertilization will not occur. That's contraception is prevented. We also have sterilization, so many of them, IUD, where they implant intrauterine copper device into the reproductive tract to prevent the passage of egg or even sperm fertilizing the egg. So, but these ones are not the ones we're talking about today. The ones I'm going to debunk its myths today is the use of contraceptive pills. One thing we have to know about these contraceptive pills is that they are they are made of hormones. They're hormonal based. There is no contraceptive pill that is not made of hormones. Yeah, that is just a fact. So whenever you hear contraceptive pills, they are hormones, they are synthetic, they're actually hormones found in the body. But these are the synthetic form of those hormones. Alright? These are the synthetic forms of those hormones. The hormones found in the body, but these are the synthetic ones used in the body. So whenever you hear contraceptive pills, just know that they are hormonal based drugs. And that is why they are able to work. They mimic the hormones already in your body. So your morning pills, your contraceptive pills, they're majorly packed with estrogen and progesterone. This estrogen and progesterone are the hormones that are necessary, very, very important in reproduction, in contraception. Remember, we are talking about contraceptive pills. So, what these hormones, their mechanism of action is to make the body not to release an egg. Contraceptive pills, they are not spermicide. They cannot kill sperm. So if you've ever had sexual intercourse and somehow you are thinking that the pill you are taking is to kill the sperm, it's not, it doesn't kill. I don't know how to place it, but just know that contraceptive pills, they do not kill the sperm. They are not spermicide. All right, and they don't have the ability to stop already fertilized egg from developing. They are not abortive drugs. Okay, so they can cause abortion, they can cause miscarriage. Those contraceptive pills, they are purely hormonal based drugs. Now this is how they work, right? Like I said earlier, they are packed with two major hormones, the progestin and the estrogen. Now what they do is to alter the release of two hormones also, the follicle stimulating hormone and the luteinizing hormone. So some of these contraceptive pills, they are high in progestin, some are high in estrogen. So what they do is they alter, like I said earlier, the hormones, follicle stimulating hormone that are in charge of releasing egg and luteinizing hormone. The brain on its own, with the injection of these contraceptive pills, the brain tries to regulate the release of follicle stimulating hormone. It depreciates it. Now, it's not going to, if you're already ovulating, it's not going to alter your ovulation. Yeah, if you're already ovulating, it's not going to alter your ovulation. Is already happening. It's not going to alter your ovulation, but it's going to affect your next ovulation because it's still going to alter the follicle stimulating hormone and the luteinizing hormone. All right, so these are the major things it does. So the follicle stimulating hormone is actually is majorly the principal hormone that allows the release of an egg from an ovary. So if you're a woman and you've taken cognizance of your ovulation, why you are able to ovulate is because there is something known as follicle stimulating hormone and luteinizing hormone. They are principal hormones that allows the ovary to release an egg. Okay, so I think I've laid the foundation of the myths I'm about to debunk. So the first myth that people believe so much, that if a handful of young girls, they believe that when you take contraceptive pill that you are going to be infertile, it's going to cause infertility. No, that is not true. The truth is, contraceptive pill don't cause infertility. It might delay your ovulation, yes, but that doesn't mean it is rendering you infertile. So that ideology you have in your head that contraceptive pills they render you infertile, you're not going to conceive, is baseless. It's not scientific proven, it's not science proven, so it's baseless. It holds no water, because once your body returns back to its normal state, your fertility returns. All right, so if once these hormones clears, once these synthetic hormones clears from your body, right, what it does is this. Oh, Samuel Latif, hi, thank you for joining my live, thank you so much. So once these hormones, once they are cleared from your blood system, your brain regulates your hormones again and they stabilize, and the eggs are released and ovulation still happens. And remember, you can't get pregnant without ovulation. With science, you can't get pregnant without ovulation. So you will need these hormones, the follicle stimulating hormones and the luteinizing hormone. And the only things that can alter them is your brain. For your brain to alter it, the estrogen and the progesterone found in these contraceptive pills we have to be altered. Okay, so yeah, your contraceptive pill does not cause infertility. So if your wife is deciding to use contraceptive pills as a means of contraception, is okay. It's not something to be scared of. It's not something to be really afraid of a lot. Okay, so contraceptive pill is also a means of preventing pregnancy. So if you have sexual intercourse with your partner, yeah, if you have sexual intercourse with your partner for maybe today or tomorrow and you are scared she might be getting pregnant, okay, Mohit, hi, hello John, thank you for joining me. All right, so like I was saying, if you have sexual intercourse with a partner, yeah, for let's say today or just this night, and you are scared she's going to get pregnant, what you can do, the emergency way you can do to prevent that pregnancy is to give her or encourage her. I'm from Nigeria, by the way. Yeah, I'm from Nigeria. The person asking, thank you so much for joining. I'm from Nigeria. So the best thing you can do for her is to encourage her to get emergency contraceptive pill. That way, she is likely not to get pregnant. And these pills are taken within 72 hours of having sexual intercourse. So if it exceeds 72 hours you had intercourse with your partner, or you as a lady, a wife, a mother, a girlfriend, you had intercourse from a partner. Oh, I'm also in Lagos. Yeah, I'm in Lagos too. I'm streaming from Lagos. So if your partner if you had that intercourse with your partner within 72 hours, she can take this contraceptive pill and she won't get pregnant. Okay, but if it exceeds this 72 hours, ingesting contraceptive pill, yeah, I'm on night, yeah, ingesting contraceptive pill is just wasting your time because it's not going to work. All right. Yeah. So that is the first um that is the first myth. So contraceptive pills don't make you infertile. And the second one, they are like, it sounds like people ask me this question, why is it that so many people that think they've heard that people that ingest contraceptive pill, they remain barren, like they don't conceive any longer. That is a lie. If you're taking contraceptive pill and your fertility does not return, it's not necessarily, that doesn't mean that it's actually that contraceptive pill that caused it. Yeah, because it does not have the ability to render you infertile. So debunk that myth. If that is the method you choose, discuss with your doctor, discuss with your midwife, discuss with your nurse, and they will help you choose if that is a better option for you or not. Okay. So the third myth is this: people believe that contraceptive pill stops period forever. Like, I've heard that case. A young lady, she came to visit her uncle who was sick in the hospital. Yeah. And I was on duty. She had some questions to ask me. And one of the questions, the complaint actually, she came with a complaint, and the complaint was this: that she is taking some injections to prevent pregnancy from occurring. And for some time now, she has not been seeing her period. That her period has not been there for months, and she was like, what is happening? What could be the cause? So I had to explain this also to her, that most times it's not like your period is not coming or the drug actually stopped your period. Meanwhile, she didn't take contraceptive pills, she took injectables, right? So I had to explain what it means to stop contraception, what contraception is actually, and she understood it. So possibly the drug she took that she was being ingested altered her body, and her body is taking time to come back to what it used to be. So yes, your period can be delayed if you take contraceptive pills, but that does not mean that the pain is going to stop your period forever, like you're not going to see your period again. No, it doesn't work that way. The pill actually will delay, will alter some things in your menstrual cycle. Remember, I mentioned earlier that how these pills work is they alter your ovulation. It's either they are delaying the ovulation or they're making it to come when they're not supposed to come. So that is basically how they work. So if you've ever heard that contraceptive pill is going to deny you your period forever, that is a big lie. You can actually take contraceptive pill, your body is going to adjust because it's actually adjusting or trying to change some things to adjust your hormonal level. Let me put it that way. The pills are just adjusting your hormonal level. So that doesn't mean that you are going to not see your period for a long time. No. But if this continue, if you take a contraceptive pill and it's from 3 months, 4 months, you are yet to see your period, and you've tested negative to pregnancy, yeah, right? Please go to the hospital and have further investigations. It might not just be your period, the contraceptive pill you took. The other things that can delay your period from coming: anxiety, stress. Am I too fast? You said I should calm down. Okay, I think I'm going to um bring it down a little. So I was saying, if you take the contraceptive pill and your period doesn't come for 3 months, 4 months, okay, what you're going to do is go back to the hospital. Yeah, go report yourself to the hospital and let further investigations be done in your body. Okay. Yeah. So the fourth myth I want to debunk tonight, I want to bust tonight, and I believe after this life you should be able to be aware of these things. All right. The fourth myth is, can people believe actually that when you take contraceptive pill is going to cause fibroid. That people who have fibroid, women who have fibroid, is because they took contraceptive pill. That's a very big lie, okay? Women who have fibroid is not necessarily because they took contraceptive pill, even though that this contraceptive pill can alter your hormone, all right? But that doesn't mean it is what caused your fibroid. No, the causative effect of fibroid is different from this contraceptive pill. They don't really cause, there's no evidence yet, there is no scientific backing that this contraceptive pill causes fibroid. So if the fear of having fibroid is what is making you not to like prevent that pregnancy, when you know you're not ready for it, when you know that you are not financially, you're not emotionally, you are not ready for this pregnancy, you don't want this pregnancy, and you still allow, you still want to not take pills, please, pills are safe even for those who have fibroid and for those who do not have fibroid. Contraceptive pills are safe for them. So if you are scared, I'm telling you today that there is no evidence yet that contraceptive pill causes fibroid. So if you are scared of coming down with fibroid, no, fibroids are not caused by contraceptive pills at all. So yeah, it does not, okay? And another myth people believe, a lot of girls believe so much, is that all pills cause weight gain. No, not all pills. Like I told you, there are so many contraceptive pills depending on the ones you're taking, but majorly the major constituent of those contraceptive pills are hormones. They are hormonal based. Now, why so many people believe that once you take contraceptive pill you're going to gain weight, you're going to gain massive weight, is because there is estrogen in it. Yeah, and estrogen has a way of making someone gain weight, and that is why, when as a lady, when you are about to ovulate, when you are about to, your ovary is about to release an egg, because of the upsurge in the estrogen, you notice that your breast becomes a little bigger, it becomes a little tensed, you are feeling more heavy, because yes, your fat cells are kind of getting inflamed. Let me use that word. Your fat cells are getting inflamed because the estrogen level is high. Okay, the estrogen has a way of playing with your fat cells, and that is why people believe so much that once you take contraceptive pills that you are going to get fat, you're going to get so out of weight. If you're getting fat, if you're getting out of weight, even though that the contraceptive pills, they will kind of alter your weight a little, like I said earlier, because of the estrogen in it. If you are adding excessive weight, please get yourself checked, your diet, your exercises, your lifestyle, what exactly are you doing gaining that weight, okay? So don't just feel like because you took contraceptive pill that's the only thing that will make you to gain weight. No, even though it's going to touch your fat cells a little, but that doesn't mean it should overly make you to grow out of size, okay? So debunk that myth, just throw it to the bin, trash it. It's not really factual to say that once you take contraceptive pill you will get weight, all right? And the last one, yeah, the seventh one, is that the truth is people think that when you take contraceptive pill you still ovulate. Now, if you've not ovulated and you took contraceptive pill, let's say your ovulation is supposed to come in 4 days or 5 days from now, and you took contraceptive pill today, okay, is either going to shift it forward or backward. Yeah, that is what contraceptive pill does for you. So you can't ovulate the day, like you can't take the contraceptive pill and within that 72 hours you are ovulating. No, within 72 hours you're not going to ovulate. Let's say the ovulation is supposed to come tomorrow, because you took it this night, it's going to alter, it's going to push it forward. All right, because why is he pushing it forward? Remember why you are taking contraceptive pill to prevent pregnancy. If it doesn't, if those pills doesn't push your ovulation forward, the sperm stays in your body for 5 days. The sperm can stay in your body for 5 days. Okay, so if you take, if the pills don't push, if the pills don't push your ovulation forward, there's possibility that you are going to get pregnant within those 72 hours, right? Because like I said, the sperm can survive in your body for 72 hours. Now within that 72 hours, what the contraceptive pill is going to do for you is that it's going to thicken your cervical wall, it's going to thicken your cervical wall, making the sperm very, making the environment not easy for the sperm to get to the egg. Let me put it that way. Okay, so if you take, let's say you had sexual intercourse this night and your ovulation is to happen next 2 days, your cervical wall will get thickened. Those pills will enable your ovulation date to be shifted. It will not happen the same day any longer. If you're expecting it on, let's say, Friday, it may not happen on Friday, because within that Friday, let's say you had sexual intercourse today, within 5 days the sperm can survive. And why, when you're taking the contraceptive pill is aiming at not allowing this sperm to get to the egg, and not allowing any egg to get fertilized or to be released from the ovary. So if you're taking it, if you take it outside 72 hours, sorry, after the intercourse, you are likely going to get pregnant. So if this pill must work for you, you must take it within 72 hours, and most accurately the first day of that sexual intercourse. Okay, so yes, if you take contraceptive pill, you're not going to ovulate that day. All right, and if you're ovulating already, if the egg has been released, the only way it can save you from getting pregnant is to alter your cervical mucus, to make it uncomfortable for the sperm to get to the egg. All right, so this is basically it. So debunk that myth. Contraceptive pill, they don't make you to be infertile, they don't cause barrenness, they don't really add that so much weight that people believe they add. Okay, and they don't cause you to have fibroid. Again, fibroids are not caused by contraceptive pill. Hi Jeffert, thank you, welcome to my life. Condoms are not, sorry, fibroids are not caused by contraceptive pill. So if you are scared that when you take pills to prevent pregnancy that is going to cause fibroid, no, the causative effect of fibroid is just different from pills. And please, Jeffet, ask your question very well. You asked why what exactly, so I'll be able to answer you. Okay, all right. So contraceptive pill is a safe way of preventing pregnancy, a very, very safe way of preventing pregnancy. If you don't, some people go under the knife, yeah, some people go through implants. There's what we call implants. Maybe on another tomorrow or next, I will tell us the different types of contraception, that contraceptive method people can use to prevent pregnancy. For married people, so most times they go for a longer ones, like the implant that will take 3 to 4 years or 5 years before it will be removed. Some decide on their own to do sterilization, to remove their uterus. Some decide to remove the tubes that helps in production of sperm. So any ones that works for you. Condom is also a means. I hear people saying, condom is not a means of contraception. No, condom is a means of contraception. In fact, it's only condom that can prevent you from getting STI. Of all contraceptive measures, if you're not comfortable with taking pills, please use condom. It is affordable, it is accessible, it's everywhere. Condoms are everywhere. You just have to get the one that works for you. If you're a lady, please have female condom. If you are sexually active and wouldn't want to get pregnant, have female condom close by. And if you're a guy, have male condom. Please know your sizes. If you're not comfortable taking pills, if you don't want her to take pills, you can have condoms and protect yourself. And condoms, they come in sizes. Yeah, they come in sizes, so don't just go for the one that is loose, and don't dare yourself wearing two condoms. You are taking the risk that it might actually get torn. One might get torn, so don't try to, overdo it. Don't try. I have what I call 10 commandments of condom, and I think the first one I wrote there is, check the when you get a condom, check the expiry date. Some condoms are expired condoms are liable to tear and wear. Okay, so they can easily tear and you wouldn't know, and sperm can slip into her body and cause pregnancy. And if you're a lady also, we have female condoms. You can walk into pharmacies, you can walk into hospitals, and you can get condoms from them. All right. And another commandment I wrote about condom is this: do not use your mouth, your lips to open a condom. Sometimes, out of the excitement that comes with sexual intercourse, the fun, the pleasure, and everything around it, you just, as a guy, you just open the condom with your teeth. It's risky because sometimes your teeth can actually tear the condom without knowing. Okay, and when you get a condom, let's say this is a condom, maybe on a very good day, I will demonstrate how to wear a condom on this live. Yeah, this is a condom. Remember, when you want to wear, pinch the tip so that there will be a breathable space, right? Why are you pinching? These are for male condoms anyway. Why are you pinching the tip? That tip is going to allow sperm that will pour into it and not leak out. Okay, that small space you are preserving in the condom is going to allow sperm to come in. Like when you ejaculate, sperm will be there, so it wouldn't splash or move back because there is space where it can actually enter. Okay, so don't just get a condom and you put it on. It's not something that you should do. Another commandment I know about condom is, don't wear a condom when your penis is not erect. Yeah, I don't know how guys do it, but you don't wear a condom on a flaccid penis. Your penis will have to be erect before you wear a condom. Okay, because when your penis is not erect and you're wearing a condom, is also causing constriction of blood flow to the penis. When the penis starts getting erect, what actually makes your penis to get erect is blood rushing into your penis. Okay, so the excitement that comes with it is that your blood vessels, they will open up and blood rushes in and causes that hardness you will feel in your penis. Okay, and another one is, do not reuse a condom. If you had your first round with the first condom and you want to go for the second round, please remove the condom and wear another one. Don't wear the same condom for the first round, second round, third round. No, you've had the first round of sexual intercourse and you had the second round of sexual intercourse. Please remove your condom. Don't reuse it. Okay, don't reuse the same condom over and over again. That one must have had a tear somewhere and you are reusing. And remember, you've already ejaculated into that one. Don't reuse a condom so that the sperm will not overfill and you don't know when it leaks into her vagina. And if you're a guy and you don't like wearing a condom, you can approach your partner to wear a female condom. It's not necessarily the culture or the way we've made it to be that it's only the guys that should be wearing condoms. No, you, as a lady, you can also get a female condom. Okay, yeah. So, and another commandment is always get a condom of your size. Okay, if you don't know your penis size, when you are erect, get a ruler or a tape. Okay, we have the small, the large, and the medium size condoms. It's written on their body. Some condoms, you see the sizes there, right? So when you get when you are alone or when you are sexually aroused, you can get a tape and measure the length of your penis. In my channel here, I think I've talked about the average size of a penis. Okay, I'm also going to post it on a poll. What is the average size of an erect penis? Let's actually know people who know what the size of an average size of a penis is. So that is it. I think that's just it. So if you have any question, I still have one person on my live presently. Yeah, I've spoken for 30 minutes. Oh wow. Thank you everybody for joining me. Remember, what I spoke today is about the myths around contraceptive pills. So encourage that girl, if you have unprotected sexual intercourse and you both are not ready for pregnancy, you're not ready to father a child, you're not ready to mother a child, to be a child's mother, please, I encourage you, do not feel shy. Walk into the pharmacy, get a contraceptive pill within the first 72 hours of that sexual intercourse and take. And remember, they always come, take the complete dose, don't just take, if it's 2 tablets, take the 2 at once. And if you vomit immediately after taking it, please, I beg you, repeat that, because whatever, you vomited it already, so it won't work. Okay, so yeah, thank you so much, Jafet, for joining me. Thank you, Mohit. Thank you so much, everybody that joined. Thank you, Samuel Latif. Thank you, my top fans. Thank you so much for joining today. If you have any question, yeah, please drop your questions. I'll be here to answer you. Okay, everything sexual health, that's actually why my channel exists. Your reproductive health, your sexual health, that is what I talk about. Condoms, pregnancy, ovulation, erection, sexual intercourse, name it, menstruation, that is what I talk about. All right, so I'm going to go right now. Thank you so much. You can view this live. If you're not joining now, I talked about the myths of contraceptive pills, so you can view this live. I'll be posting it on my handle, Med-Xposé, so you can follow me for more. I make videos, I create videos about sexual health. So if you want to know more about your sexual health, your reproductive health, you can always ask your questions in the comment section or in my community. All right, we can start a conversation there, who knows. So thank you so much for joining me today. Thank you for being here. All right, so bye everybody. Remember, drop your comments, drop your questions, ask your questions, feel free. No shame, no guilt. I'm just here to give you that clarity you need. Okay, that clarity you need about your sexual health. Feel free to always talk in my community, to ask your questions on my videos. I'm here to answer you. And don't forget to subscribe if you've not subscribed to my channel. We have many educative and fun-filled videos on sexual health coming your way. All right, bye, see you tomorrow. Yeah.